everyone. This is Dr. Krishna Prasad, practicing as a general physician in Pranam Hospitals, Madinaguda. Today, we'll be discussing about the latest updates in hypertension. And as per the WHO, nearly 63% of the total deaths in India are due to non-communicable diseases, and among which 27% are alone attributed to the CVD, which affects approximately 45% of the people in the age groups of 40 to 70 years. The raised blood pressure is among the most important risk factors for the CVD. Moreover, it remains poorly controlled, basically due to the low awareness about the hypertension, the lack of appropriate care, and the lack of proper follow-ups. And coming to the Indian scenario, in India, the prevalence has alone gone up over 30 years to 38% in the men and 32% in the women. Despite that, nearly half of the people, or 51% of the men and 41% of the women with the hypertension, were unaware of the disease themselves. Additionally, over 62% of the men and nearly more than 53% of the women living with hypertension are not getting or did not receive any proper treatment. Medication was used to control blood pressure in fewer than 1 among the 5 men and 1 among the 4 women with the hypertension worldwide prevalence. And coming to the International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and then essential treatment paradigms attempts to address the issue that in a resource poor settings, optimal care refers to the evidence-based standard of care, and whereas essential standards refers to the minimal standards of care to allow specification of essential standards of care for the low resource settings. And coming to the AHA and ACC has released a scientific statement in 2021 offering the new guidance for the management of state 1 hypertension among patients with a low risk for ASCVD. Among the low risk individuals with stage 1 hypertension, the management starts with always a non-pharmacological therapy. If the blood pressure even remains uncontrolled at the end of 3 or 6 months, then the pharmacological therapy has to be started. And coming to the acute respiratory distress syndrome, which is a potentially fatal condition involving the lung damage and often is associated with the severe COVID-19. In this, a recent study, American College of Cardiology reports that metoprolol alone can reduce the inflammation and improve the respiratory function in people with the COVID-19 induced ARDS. Lowering the systolic blood pressure targets down to 110 range substantially reduce the CV adverse effects in an STEP randomized trial, affirming the sprint findings for an older Chinese population. Among the 8,500 patients in the age groups of 60 to 80 in the China, the intensive target trimmed 26% of the composite CV risk findings. From now, a second major trial supporting a lower target could unite the guidelines. And coming to with regard to the prognostic value of ambulatory blood pressure monitoring and the nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend the diagnosis of hypertension should not only be done on the dependent BP measurements at the clinic, but also should be on out of the office measurements such as the ABPM or the home blood pressure monitoring, that is HBPM. And most patients with hypertension require lifetime or the lifelong medical management to obtain the BP control. The 2018 guidelines equally recommend the 5 classes of antihypertensive drugs. Considering the non-adherence treatment, the importance of combination is particularly highlighted to improve adherence to the treatment as well as the BP control. The 2018 guidelines recommend antihypertensive drugs with an initial fixed dose combination of either AC inhibitors or an ARBs plus calcium channel blockers or with a diuretic. And HYGRI study represents the largest study tested 9-time antihypertensive treatment. In this trial, the chronotherapy was associated with a significant reduction in the endpoints. And it also tested whether the nighttime therapy in comparison to the usual awakening hypertension treatment, exerts a favorable CV risk reduction. The largest study included a total of 19,000 hypertensive patients. During an average follow-up of 6.3 years, around 1750 patients experienced a primary CV outcome. The ambulatory BP measurement was performed for 48 hours to collect the data how BP differed during the sleep. The RR reduction for the CV events was significantly improved for the nighttime treatment when compared with an awakening treatment. Thank you, one and all.